Question today is for the Minister of Health and Long-Term Care. Minister, in my riding of Etobicoke Centre, we have one of the highest percentages of seniors of any riding in Canada. And I've heard from many of those seniors, and they've expressed to me how important it is that they have access to home and community care as they age. I've also spoken to many people in my riding who are not seniors but who are caring for seniors, people who are caring for their elderly parents while also caring for their children and raising a family, and often with limited resources. And they've asked me for help, they've asked us for help to ensure that they can access the home and community care that they need to support their aging parents. And to weather this challenge, to address this challenge, it's obviously important that we continue to deliver high quality home and community care for the people of Ontario. Minister, could you specifically outline what work your ministry is doing to ensure access to high quality community and home care in communities like Etobicoke Centre?
Thank you. Minister.
Thank you, Mr. Speaker, and thank you to the member from Etobicoke Centre for this very important question. I'm pleased to tell you how our government is improving health care for seniors with complex health conditions across Ontario. I was pleased to be at Toronto Rehab last week to make an announcement that our government is investing more than $40 million in specialized rehabilitative care right across the province to help our seniors recover from illnesses and injuries so that they can continue to live independently at home. This is a program called Assess and Restore, Mr. Speaker. Unfortunately, most of Ontario's 1.9 million seniors are healthy and use the health care system only occasionally, but a small number of our seniors living in the community, about 150,000 or 8% of them, have complex care needs, and this program is geared specifically towards them. We know that sometimes long hospital stays can result in debilitation or muscle loss, weakened bones. For too many seniors, that means moving into long-term care home prematurely. This program aims to allow them to continue living independently.
Supplementary.
Thank you, Speaker. Strong community-based care is not only a preferred method of care for many seniors as they can remain in their homes and out of hospitals, but it obviously also provides relief to families. It's also a much cheaper form of care than the hospital-based care that is often the alternative. My constituents, and particularly seniors in Etobicoke Centre, have also been asking me about physiotherapy. This is a service that's critical to many of people in my community. And my understanding is the government's working to improve services in a number of ways. And I've heard about things such as one-on-one physiotherapy for long-term care residents with assessed need, enhanced access to exercise and fall prevention classes for seniors in community settings, and expanded in-home and clinic-based physiotherapy for seniors. Services like this that are based in the community go a long way in helping families as they juggle that challenge I raised earlier of caring for aged loved ones while also raising a family. Minister, could you please tell the House more about the work that you are doing to strengthen physiotherapy access across Ontario?
Thank you. Minister of Health, Long-Term Care.
Well, thank you to the member again. And part of my announcement last week, I was also able to say and announce that Ontario is expanding access to physiotherapy into primary health care settings across the province by investing more than $4.2 million to add physiotherapy services across 25 more family health teams, nurse practitioner-led clinics, and community health centres. So an estimated 71,000 people, including seniors, will now be able to access physiotherapy at the same place where they receive their primary care health services. So improving health outcomes for seniors is also part of the government's plan to build a better Ontario through its Patients First action plan for health care by providing patients with faster access to the right care, better home and community care, the information that they need to stay healthy, and a health care system that's sustainable for generations to come. Providing seniors with more supports will allow them to live safely and independently at home and enjoy a better quality of life, Mr. Speaker.